Good morning. Hello, everybody. Welcome. Happy Thursday. Today, looks like Instagram is. Hi, everybody. Today, we're going to talk a lot about some news regarding COVID. And I'm trying to get Instagram on. Okay, so we're going to talk about some journal articles, JAMA articles about the links between school closure, statewide school closures, and COVID incident mortality. This is a really big report. So this is really critical. We're going to cover that today. I also have another viewpoint about reopening of schools and some potential guidance there, as well as a whole bunch of information. So we've got some big news to report. So welcome all of you. I am honored, as always, to have you join me today. And before we kind of get started, first, I want to welcome all of you. If you are new, welcome to our community. We have a great community here on the live chat on YouTube and also on Instagram, where you can get to know other individuals seeking health and wellness tips during the COVID time. So I want to encourage you to use the live chats. And also, it's a great way to communicate with me. So I always love to go back and read, but I'm also monitoring them while you comment. So I want to welcome all of you. We've got Rachel and JP Soso and Pat, our moderator. And Janet, I got your email, so I will email you this afternoon. But really quick, let me know where you're tuning in from. Comment down below. We have an international community. It's always fun to see who pops up on our live feed. And also on the replay, I welcome you to comment down below as well. So before we really begin, I want to invite you to tomorrow. It is my birthday tomorrow, and we are going to have a birthday celebration, COVID quarantine style. I'm going to pop a little bubbly in the morning, and I'm going to have a little Bellini birthday toast with you tomorrow morning to celebrate my birthday, kicking it off with all of you on the live show and answering all of your questions. So that is my gift to you. And then I'll be taking the rest of the day off. So I'm excited. I hope you will join me tomorrow, 9 a.m. for a birthday celebration. And I might have some fun decoration here in the office, or I might move downstairs. Who knows? But at any rate, we're going to talk about news today. Big news in the world of COVID. The world hit 17 million cases. And as I started, I think the first show on our live show back on March 14th was day one of these live shows. I posted a kind of chart of exponential growth. And so exponential growth, we are now seeing it. So in 8 days, the world has added 2 million positive new COVID cases. 8 days, 2 million. So that is what we call exponential growth. So the prediction is we will probably post 1 million within about 3 to 4 days. And that's the average, what we're seeing there. So just know things are continuing to go full steam ahead. And the US is at 4.5 million cases, and we surpassed 150,000 fatalities yesterday, which is really big. I do want to highlight some international news before we go into domestic news. Brazil, they had a big day yesterday. They posted, they have now a total of 2.5 million cases, and their fatalities hit 90,000 yesterday. So that is significant. India's at 1.5 million. Russia's at 834,000. And Russia is aiming to approve a vaccine trial within the month or the next 24, 30 days. So they're hoping by August they will have some sort of vaccine. On the vaccine front, Costa Rica supposedly has a vaccine that is proving to be very beneficial. I'll dig into that. That's just kind of posted earlier this morning. And I also want to highlight that South Africa has 471,000 cases. And there are certain areas of Africa where they are identifying the new wave. And so there's definitely growth internationally. So worldwide, there's great expansion. And just like what we're seeing here in the US, we're seeing this in other countries. I do want to make a note. Yesterday was a really big day in terms of records being set for fatalities. Several states posted fatality, deaths that have exceeded previous days or previous weeks. So California, they posted 197 fatalities. Florida had another record-breaking day. They had 217 Floridians die yesterday. Texas was just blew everybody out of the water. They had 313 Texans die because of COVID just yesterday. Texas had a really bad day yesterday. Part of this, again, comes back to the private labs having such a delay. And so sometimes these delays, they just batch 25,000 positive tests, or, are batching a certain quantity of tests. So this might be offset, but just know that when we have people testing positive, there's a 2-week delay when they start to show up in hospitals. And then we see another period of time where they're in the hospital, and then there's fatalities. So Texas, they surpassed 400,000 cases yesterday. So they now are at 403,000. They're number 4 in the US in terms of the 4th largest state with COVID cases. They did end up having over 17,000 positive tests alone yesterday. Record-breaking day. And again, they had 313 fatalities. And there are certain areas where we are seeing trends. We're also seeing the border town, the Rio Grande area, just overwhelmed. Hidalgo County is the county that is just seeing an exorbitant amount of positive cases, double digit, 25-30% positive cases, major community spread. Considering it's an 800,000 resident, it's a county of 800,000 residents, and they have at least an eighth of them that have tested positive. And more obviously coming as testing occurs. As far as what we're seeing also, Georgia, I want to notate, we had another big day. We had 3,200, almost 3,300 cases posted, 79 fatalities yesterday. And our hospitalization since the beginning of the month, since July 1st, we have doubled in Georgia, the hospitalizations due to COVID. And word on the street and the healthcare community here in Atlanta is that every hospital inside the perimeter, which we've got kind of a circular highway system that kind of circles around Atlanta, everything in the perimeter, and my office is just on the other side of the perimeter. Every hospital inside the perimeter is full, and so ICUs now are being they're surge cases. They're pushing them out to certain counties. And we're also using the makeshift COVID center at one of the convention centers downtown. So I know Georgia continues to be on the rise. New Jersey posted a slim amount of cases, but we are still seeing New York and New Jersey posting cases. And so they're in the mid to moderate hundreds a day. But as things reopen, we're starting to see maybe a little escalation. I do want to make a note, South Carolina, for those of you who've got Gianna that lives in South Carolina, a regular viewer of ours. South Carolina, they have doubled this month the fatalities due to COVID. They have a total of 1,500 fatalities. Over 700 have occurred in the month of July. And they are looking back at the kind of major points of spread were Memorial Day and then the 4th of July. So very much beach going, very much vacation oriented, travel, cross-state travel as well. 4 states that are showing an increase in the positive percentage of tests being run are Ohio, Tennessee, Kentucky, and Indiana. And those are 4 states we want to look at. Anytime there's an increase in the positive percent tests. So, if everybody getting tested, a certain percentage comes back positive. When you get into double digits, anything above 5, 8, now you're in 10, 15, 20, anything above 5% is indicative of community spread, out of control community spread. So they are, all 4 of these states are showing an increase in the positive percentage, meaning for every case that we're seeing, there could be anywhere from 6 to 24 other individuals who's been infected. And that comes from data that we have from the CDC in terms of the serologic testing. I've posted that last week. I do want to notate that Florida is extended. The governor has extended the eviction and foreclosure proceedings. And that's really big in terms of the economic hit that a lot of Floridians are experiencing in regards to COVID, decrease in business, and even furloughs and layoffs. So this has been extended to September 1st. That's a really big effort by the governor. So that is good news. The bad news in Florida, Instagram. Hi guys, Instagram, we might be buffering a little bit. I don't know what's going on here. Okay, so hold on. Let me hold on, Instagram. I'm gonna switch my Wi-Fi. Hold on 1 second. Yeah, okay. So let me switch. I have to switch my Wi-Fi. There we go. Okay, so Instagram should be good. Okay, let me go back. Okay, Instagram. Sorry, I switched my Wi-Fi. We should be all good. We've been having weird Wi-Fi. We got boosters and it's been just weird. But on the bad news in Florida, there's a tropical storm coming, barreling through and heading towards South Florida. And this is pausing all of it's buffering again. This is pausing COVID testing. And so they are going to have COVID testing through 5 p.m. tonight. They expect the thunderstorms to occur starting tomorrow. And if you have ever been in Florida during a thunderstorm, they're pretty intense. There's a lot of lightning, thunder, scary. You have sideways rain. And so it's definitely not a good situation when you're trying to, take swabs of people's nasal cavities, but also, just the wind too is just, it's not safe for these pop-up tents. So they're closing the testing sites throughout the state up through August 5th. That's when they predict everything should blow through. But the county health departments still remain open. So there are, fewer facilities, obviously, in each county, but you can still get tested throughout the state of Florida. It just might be longer lines, and it just might be challenging. So that's just that poses its own challenge, and hopefully there isn't a lot of damage. We did see one of our viewers, Christine, her grapefruit tree got taken down by the storm that came through. I think it was it Hurricane Hanna? I don't even remember. But she's in cleanup mode. So hopefully that doesn't affect a lot of Floridians. And the worst case scenario during hurricane season is to have people evacuate and then go to hurricane shelters where there's minimal social distancing. And I don't even know if FEMA and the states that would be dealing with this, if they're ready. I mean, this is one of those things, Floridians would just kind of expect. You always have kind of your stash of hurricane supplies, and always my friends who always had extra wine on hand because you're going to have candles, wine, toilet paper, water, all your supplies. But the reality is that if people have to shelter outside of their homes, what are the safety points going to be? So let's just cross our fingers. 2020 is an easy year in terms of hurricane seasons. It would just exponentially make things worse. Also, I do want to highlight that in Houston, Texas, particularly in Houston, if anybody ever called, from February up until now, if they called 911 dispatch for an emergency, the dispatch, whoever answered the call, they would ask them certain questions about COVID exposure. Well, now they're stopping asking those questions. And it's a big concern, for the firefighters who are frontliners. And we have a lot of firefighters. We have some firefighters and chiefs in our family. And I have some friends that are in the firefighting community. And it's a concern because the frontliners, they need to be prepared. And I think at this point, it's just kind of the expectation. It's such a community spread. Just assume everybody is potentially contagious. And that might be one of the reasons why. The other reason that they did indicate they were not completely, they weren't completely trusting that when people were asked if they had COVID exposure, if they were answering it correctly. And so there was some communication that they were afraid people weren't calling because of COVID exposure. So the city itself decided to disband the questions. in the hopes that they'd be able to better serve their community. The question is, how protected are the firefighters? And it's a honest, valid concern. So that's just kind of where we're at in Houston. The long haulers, that community, the Survivor Corp that I'm following now on Facebook, it's a private group for anybody who's had COVID. It is now a clearinghouse for surveys, research, media, interviews, and things like that of these individuals who have had COVID that are dealing with symptoms for weeks and sometimes months on end. And a physician, a medical provider, through some research at one of the universities in the Northeast, she did a survey. She did a long hauler survey, surveyed 1,500 of these patients. And what they've identified is a minimum of 100 days, they're dealing with over 100 different types of symptoms, all over the place, from body aches and pains being the most common. So muscle pains, aches, joint pain, internal, like lung pain, throat pain, to also really bizarre symptoms like double vision problems. Some have temporarily gone blind. And what they've shown is, at minimum, the long hauler symptoms last for at least 100 days or more. And they will have an assortment of symptoms that sometimes come and go. And so this is obviously one of the reasons why it's just not, the degree of COVID is just not about your fatality rate. And that's really, as medical providers, what we're trying to have people understand. Wearing masks, social distancing, practicing good hygiene, not touching your hands and, your hands to your masks and then your eyes and all this stuff. It's less about fatality. I mean, that's obviously part of it, but it's also about your risks. A lot of individuals have underlying health conditions that get exacerbated. Others don't. And then they develop underlying health conditions. And these will be permanent, like the diabetes development, that's going to be permanent. We're also going to see the heart-related inflammation, the heart involvement, as I mentioned yesterday in a few other videos. So this is really critical. And some folks that are in the community, as I've noticed, some are testing positive or testing negative several times, but are experiencing these symptoms. Others are getting diagnosis of, severe bronchial inflammation, but they have all these other symptoms. And so, it harkens back to what tests are they taking and how accurate are they? But the long haulers are a perfect example of why we really want to avoid coming into contact with this virus. That even if it doesn't create a fatality, if it does not kill you, it can, and this is horrible to say, but it can maim you. I mean, the reality is that the long-term impact from the inflammation of the heart, the changes in kidney and pancreatic function, and the blood clotting impact, the strokes, the neuro-COVID, these are going to be potentially lifetime long underlying health concerns and health diseases, health issues, diagnoses, and disease patterns that we're going to see in our community. And it will affect all of us. I mean, that's the unfortunate part. Even if we don't get sick, we will be impacted by our friends, our family members, our colleagues. It will be something we're going to be dealing with for the longer term. I do want to make a note that there's something even more potent and more contagious than the virus itself is misinformation. And there is a huge amount of misinformation from a whole government parties, but all collectively are trying to minimize the impact of the virus. They're trying to minimize those who have the virus, calling them liars, the COVID deniers, denying that is even real, to folks that are anti-maskers or are trying to avoid reducing public safety. This is, the psychology behind it. People are going to manifest or hear things that they want to know about, that they feel like they already know about. So, the inclination to post and repost some of the unfounded, statistically, scientifically non-founded information is very detrimental to our global health. And it also stems from denial. It stems from stress. And then it's become this political thing that it shouldn't be. But I also do want to make a note that, there are more and more individuals that fall into the category of COVID deniers and anti-maskers who are, in fact, coming into contact with the virus because of their unhealthy and unsafe behaviors. And we've seen that in the legislative bodies. And we saw Alabama had dozens of individuals who were forced to, be in the Capitol and vote and do all these legislative things. And then a lot of them got sick because they weren't wearing masks. Same thing recently with a Texas rep in the U.S. Congress who, not wearing masks. They actually have, this is so horrible. They have video of him, like he's wiping his nose and then he touches desks and other people. And I mean, it's just insane. And I really also want to encourage you all to do fact checking, to encourage fact checking of friends, or if you see people posting, we really have to stop it. We have to minimize and mitigate this spread of misinformation. It's more viral than the virus itself. And also, we also need to understand that there are countries and the political drivers that play into this. We're seeing China and Russia strategically creating these misinformation campaigns about this health crisis. And that does nothing but divide us. And it also continues to spread this just very contagious misinformation campaign. And it is very caustic to our health and wellness. And so I just want to put that out there. I have some notes as far as the world of sports. So today, the NBA kicks off their games. So that's exciting. We'll see how long that lasts. But I also have some communication about Atlanta, and it's linked to the demise of the Marlin team and their COVID cases. So apparently, the Florida Marlins were in town on the 22nd, so last week, to play an opener game with the Braves, and one or two, maybe more, Marlin players went out in Atlanta. So they went out for, I think food and drinks, maybe dancing, who knows. But that is where they have identified, they've contact traced the Marlins caught COVID in Atlanta and then spread it amongst themselves on the team and then traveled, put more folks at risk. And right now they have a total pause on their season. But it all originated here in Atlanta. And we have a massive amount of spread, especially in the Fulton County area, which is where they probably stayed. They probably stayed in Marietta, where the stadium is. That's really close to where Brian works. Or they stayed in downtown or Buckhead. More than likely, they stayed in Buckhead. Really great restaurants and lots of bars and stuff. They're all open and minimal social distancing happening. So there also have been links to some, like there were some Clippers players in the NBA that were in town, went out in Atlanta. They caught COVID. So Atlanta is definitely not a place for any of you to come to and go out, because we're definitely seeing some spread. The other thing that is, I came across it yesterday for Gabriel. It's been out for about a month, but I do want to highlight that Sesame Street is weighing in on COVID information and a campaign to educate kids and to also address the emotions behind social distancing, not seeing your friends, fear of a virus. And I really think this is such, Sesame Street is so progressive. They always have been kind of really open and upfront with different kind of cultural changes. And in the world of COVID, kids are having a tough time. And that's actually the topic of today. We're going to talk about school openings and some data that has come out. But specifically, there is a Sesame Street special. It's on YouTube right now only. And it's called Elmo's Worldwide News. It's Elmo World News. That's the name of it. And it's a 25-minute show. And they have like Grover reporting. And they have, all of these different characters addressing the different elements in children's lives being hit and impacted by COVID. And it is one of the really great resources that you can provide for your children of all ages. So I want to put that out there. Google Sesame Street. Elmo World News is the particular name of the show. And they definitely address some really important factors to address. But they make it in such a way, like they do a COVID ABCs, and they address it in such a valid way for kids. I just love Sesame Street. Growing up on it, I think it's fantastic. Gabriel adores Sesame Street. So it's so fantastic. I also want to highlight that the UK has just funded a significant study to assess in the UK why people of ethnic minority backgrounds are at greater risk for COVID. And so that's really big in terms of at least the UK assessing racial disparities. They are going to dig into varying elements in terms of healthcare access, the different types of jobs that they work, all of that, access to PPE, and the influence that might occur in socioeconomic disparities, but also just underlying maybe there's some genetic elements, and mostly this is information we can use to then equip ourselves with educational resources to target these communities so we keep them healthier and minimize the risk. So those are kind of really big points of news today. I do want to highlight. So today we're going to highlight, there's a Journal of American Medical Association, the JAMA. They've got an investigative report in here where they look at what they call it non-pharmaceutical interventions. So school closings being one of them, as a specific way of either limiting, reducing the spread and the influence. And so they look at the U.S. population between March 9th and May 7th, and they look at the association specifically of school closures with outcomes of state-level non-pharmaceutical interventions. And they attribute any type of negative binomial regression model. So they look at any impact, did that dip? Did we see a decrease? And then also they look at potentially the time that a school was closed. Like some states didn't close fully. Like Georgia was full on. We had one teacher like in the first week of March, and that was it. Like school, they closed it for 2 or 3 days. And then next thing we know, like it's full on for the rest of the season. So they talk a little bit about the impact that school closing had and the changes and the mortality. And what they link is that the schools that had, or the communities and the states that had the lowest instance of COVID, had a relative change in terms of the length of the school closure. So there's a direct link between closing a school and the length of time that's closed, as well as the reduction of COVID. So part of this is also, you can look at the reverse potential of this. So if we show, and then in this analysis, that school closures, there was a change in reduction of the instance by 62%, and the mortality was affected by 58%. It's likely that we might see the reverse of that. Like if kids start to go to school, we might see an uptick in the spread. And so this models specifically the beginning of the school closures. And now we have the experiment, which is school opening, and we're going to see what happens. And so this talks a lot about the different types of symptoms kids have. It also looks at some of the lag times in terms of schools closing and some of the testing. There were definitely a degree of testing lags, and not everybody was tested. But they break out some of the different states. So they list out all the states here, and they look at different variables here. And what they look at is states by COVID incidence, And then they look at the date the school was closed. They looked at how many people were being tested, per 1,000 residents. And then they looked at number of nursing home residents who were tested positive, the state obesity percentage. They looked at urban density per square mile. Then they looked at, so they call it a social vulnerability index. It's kind of interesting, but basically, how social are you and how much contact is your risk of exposure. And then they look at the days between the days of the closures. And it's very interesting, like the low incidence. We saw North Dakota had low, Alaska, Arizona, North Carolina, South Carolina, Michigan, Hawaii, Oklahoma, Ohio, Virginia, and Pennsylvania. Those were on the lower side. And what is interesting is the highest. So in the beginning of this, the highest, they rank it. So this is, second highest and this is highest. And the second highest is where we're seeing Florida and Georgia. Texas was actually in the second lowest quartile. So, there's some variables at play where, the schools closing, it may very well have kept the spread low in those areas. But the highest, California was the highest out of all of the states in terms of the instances of COVID. And some of the cases in here, they also had Massachusetts, and they had a major significant spread in the nursing homes where it was a little bit different than the schools. But this is really fascinating. They look at, they break it out in different charts in terms of the instances and some of the growth. Like this one state, this is, let's see. Yeah, the highest. So this would be California in terms of the day of the school closure. So this is very fascinating for us clinically to look at in terms of just the role school closing had and the ranking of the states. And then if you look at, you can also pair up those that were highest or even on the lower scale. If they reopened a little sooner, that could very well be part of the reason why they're having a spike now. So they go even into the mortalities. So that was instances. This starts to list out the mortalities and different factors like who is in the lowest, who is in the highest, and the deaths per capita. And I think one of the things that we're going to see is based on this data, there's a likelihood that the school reopening, depending on how schools are reopening, it could very well be that we will see the reverse of some of this data. So, time remains to be seen with that, but it's definitely something where we need to reassess. Okay, so that's what we're doing. Today, we actually have an interview with a tutor teacher to come in for a few hours every day. To have one-on-one time that's educational. We need a third party to kind of take that off of that relationship he and I have, where he's not always open to mommy teaching him. I think it'll help. It also will help me be able to do a little bit more work for all of you. But that's what we're looking at on top of virtual learning, apps and things like that. Also activities that I will be doing with him every day. And we're also looking at adding in some physical related activities. Like we have tennis. We have a tennis court here in our neighborhood, and I'm going to have a tennis teacher teach him lessons, and we're going to do virtual Spanish. So I'm piecemealing some sort of academic program that goes beyond my scope and also helps him get some foundational. So that is what we are doing in our household. And the school that Gabriel's part of, they are going hybrid. They're also going in person. I've been seeing emails from them about what campus looks like. Like they're using all aspects of the campus. They've got a music area outside. But it's also a school that's from nursery to 8th grade. And so the children 10 and older can spread just as effectively as adults. And that is not comfortable with us. And they're doing like little pod groups and So, I mean, they've changed the whole entire campus. They've got outdoor education. They've got like there was this little area with preschool, they had like fake turf, and the kids would, have their sensory centers and do their little tricycle bikes. They've turned that into like the reading area. But it's not making us comfortable. But I do want to highlight, there is an additional report that was posted by JAMA that is talking about reopening K through 12 schools during COVID. It comes out of the same group last week that posted information about school, the National Academies of Sciences, Engineering, and Medicine. And they specifically talk about the need for evidence-based guidance and highlighting that reopening schools entails weighing public health risks of opening against the educational and other risks of keeping schools and the buildings closed. And so they talk a lot about, the benefits of families to reopening, from, both parents being able to work to, both or one parent being able to work to, childcare services, mental health access, food access, and the ability to have a safe place to go to that might not be safe at home. So they highlight definitely the complexities, and it's more of an opinion piece, but their focus is it has to be more focused, more centralized in those communities. So a national program or national, like, we're reopening all schools, it might not fit if your community is in massive spread. So if you are, say, a student in Hidalgo County, you are a principal, you're a teacher in that community, and you are the epicenter here in the US. You have massive fatalities happening. The community spread is over 30%. 1 in 3 individuals has COVID. That might not be the safest place for children and families and educators and janitors and cafeteria workers go to support their community. That might not be the most safe place for children and community members to be focusing on in person. But they talk a lot about the need for more research. We need to know schools and the contributing community spread. This particular component doesn't look at community spread, but looks at, did it reduce the amount of numbers? Did we see a dip, and did we see any type of change or reduction in mortality? But they're asking for more information about the links to community spread, airborne transmission, and the big thing that this particular opinion piece highlights is ventilation. How clean is the air, and are you just spreading it HVAC through 4 or 5 classrooms? And that's the one thing with the HVAC. I think we got UPS coming. The HVACs definitely play a role in terms of potentially moving contagions. And when schools reopen, I always remember having some degree of kind of nasal stuff because, they're getting the air conditioners fired back up and there's dust. And so it becomes really critical we have clean air also at school. But this opinion piece just goes further into, we need more information, and highlights some additional research like we saw posted here within the school. So I definitely want to answer any of your questions about schools. It's a struggle. I'll be honest with you, as a parent, and we have, one parent who has underlying autoimmunity that could be very devastating with COVID. So we're on the really low risk side, and our really low risk side, we're not even looking at a pod in our community. It's our child with one other adult who's highly limited, who has their own kind of health concerns, and just having them engage with him and how that works. I'm more than happy to kind of explain more of what my thoughts are with that. But I have my UV filtration in the room. I have a salt lamp. We're diffusing aromatherapy, and how do we make sure that that's also a safe space? So it's definitely, it's a very challenging spot for a lot of parents to be in. Jean's gluten, egg, milk-free goodies. Hey, Jean, she's She's got her tea. Okay, so let's see. I know you've been doing pandemic coverage. I'm looking in your recordings for those specifically struggling with autoimmune. I have a lot of autoimmune related videos. YouTube's the resource. So if you want really specific content, YouTube, 500 plus videos, you can search. If you go to my YouTube channel, there's a search bar. You can search within. The idea, the focus with my video content is to allow you a clearinghouse, a library, if you will. And at some point, probably in the next year or so, I want to develop my own a community membership program where we have really specific dialogue and access to additional content. One of the things that's of concern that I always have is if something happens to YouTube, like I have had a few issues with some of my content getting strikes and being banned for a few days and even up to 2 weeks and producing content and dialoguing, having communication with you. It definitely highlights a need to have some controlling aspect of my content. And so that is something I'm working towards. COVID has put a wrench in a lot of my plans of expanding and growing our access points to all of you, but it's definitely something that right now, YouTube has all of my content. Jenny Allwood, I'm a teacher. My husband works at a university. My daughter attends a different university, and my sons attend another school. Lots of context between the 4 different schools. We are terrified. So Jenny, my question to you is, are any of them going virtual? I know the universities are taking a bit of a different stance than the in-person schools. And there's such a difference between, like kindergarten through 3rd grade. It's a very different setting where, the lung capacity, they're definitely showcasing a reduction of spread. And even, we got our little mask pack here for Gabriel. Even if they're like fumbling with it, Gabriel's doing really good. We have him wear his mask for his Sunday play date with his friend. And the thing is, you take your mask off, like if they eat snacks, so they pull them down, they eat their snacks, they pull them back up. And I have extras because we've gotten chocolate and, dirt and chalk on the mask. But one of the things is, Gabriel knows if you don't wear your mask, or if you you refuse to, then play date's over and you can't play with Ari. So we definitely have laid that foundation. It's going to be a challenge, I think, with kids that aren't used to it. So it's definitely a good idea to get your mask, try them out, have kids practice wearing them. You wear them as a family, kind of minimizes the impact. Pau's teaching Spanish. That's awesome. Yeah, there are a lot of really good resources. So, our European trip's been delayed, and we could even do German and French. And with Gabriel, why not? His little brain's a sponge where, I have my mommy brain that's not really great at languages. And so I just want to change that with his brain. He's really into music, and I don't know how to do that in any social distance way. We can't do music lessons, like piano lessons, virtually. And we're not going to go to anybody else's house. So we've got to figure that out. But Jenny said, say hola to Gabriel. Yeah, I actually, you know what, Jenny, he's been learning Spanish. He has a pretty darn good for like entry level, pretty good recall of Spanish. I just want, like, even in his schools, like every sixth day, they kind of rotate. I call them specials. And so we'd have like social studies one day, and then you'd have art and music. And so, I can do the art and some of the other things every day, and supplement. Like, we will watch experiments on YouTube, and there are honestly some really good stuff out there. Like, he's learning about friction and momentum, and just some really, really advanced, I think it's advanced stuff. I don't remember learning anything like that. But online. But to Jenny's point, the touch points, you have to kind of anticipate and calculate, how do you reduce those? And so with the university setting, I'm curious if there is that virtual option. It definitely, for schools and adults in their own category, there's definitely a risk factor. And that is where, I wish I had it right in front of me, but I've highlighted like the riskier of behaviors. if everybody has a certain degree of risk, now you've got to kind of articulate your average risk. And if your average risk is moderate, you definitely don't want to do high level activities on top of that. Like, you'd want to do low risk activities to offset the moderate risk. And I think that is probably the better way of kind of living in and amongst COVID. So for instance, this Sunday, the dads are doing the play date. We are now doing this Sunday morning play date where the two boys, they get together, they bike and they chalk, and it's just social and it's great. So the dads are going to do it. And this Sunday, I have to stock up at Trader Joe's. I have not been since my last Trader Joe's haul. And I filmed it. I don't even know if I edited it. It just got so chaotic at the end, but we're out of some of my core essential Trader Joe's stuff. And now with my super freezer in our garage, I'm going to stock up, but I want to go there at 9 a.m. Sunday morning. I want to be in and out in 10 minutes, get home and chillax. So, for me, that's my high risk level of activity would be going to Trader Joe's on Sunday. Why doesn't Trader Joe's deliver or even order online? Like, I have messaged them. I keep saying, I wish you could deliver. I wish I could have somebody shop for me. So Sharon says, get him a keyboard with light up keys that teach him to play. Then when he was 6, he could start learning regular piano. My daughter started violin at 4. That's awesome. So Gabriel School, they actually have them learn either keyboard or I think the cello might be what they work on. It might be violin in their music, but we definitely, he's very creative. He plays drums. I got him drumsticks. He plays drums right now on my big yoga ball chair. And he gives concerts all the time, but we set up a little keyboard. It's got all these additional settings. I think he wants to be a DJ at this point. So senior in high school and sophomore in college, they both will be doing e-learning. Tanya, that's good. Okay. So Jenny's family everybody's attending schools every day. My class will attend in a hybrid model, but I have to be at school every day. Yikes. So, and the hybrid model, it seems like the hybrid model is a lot more work for the teacher. Confirm that and let us know your thoughts. I'm curious, not being in that zone. It seems like you're managing in person and you're trying to cater to some virtual engagements all at the same time. Connecticut schools are opening in September unless something drastic changes. Class sizes are being reduced and we are being assured all safety measures will take place. Gabriel School did something where they changed the HVAC. So they changed the HVAC. Everything is contactless. So the lights contactless, all bathroom facilities contactless. They now have set up additional sanitary stations, but they're all contactless. So that was a big, big addition. Let's see. Christine or Trader Joe's is the best. Yeah, everybody said they're being careful. What I don't want to do is get caught in line and I see people not wearing the mask in the line. We drive by there and I kind of scope things out. Okay, she has a face-to-face classes and racking up student loans doesn't sound good without. Yeah, I hear you. One of the things with the college students are they're not in person. Okay. Janet bought a waitress apron to wear in school to hold my phone, hand sanitize. That's smart. Keep your things clean. Hybrid is much more involved and time consuming. Yeah. And I'm feeling for the teachers as you guys now teachers now are the new nurses, the frontline workers. And supposedly, I don't know how this is working out, but Gabriel School created a room. It was some storage room. It's now their isolation room. And I'm curious if you guys are seeing there being isolation rooms in the schools or communities. The big question is, what do you do if a teacher, a worker, or a student gets sick visibly in the class? And so there's going to be this place where they send them to. We have a nurse on campus. Her name is Nurse Payne. How crazy is that? Paine. And so Gabriel's had a few instances where he's gone to her office. they've been really strict with what all I can give him. So like I have homeopathics, some of my cold calm and things like that for him anytime he'd feel, most of the time it's his ears, like he gets the fluid in his ears. And, we had to go through hoops to get that stuff in there. I know our school's letting us bring in, or, not us, we're not going in, but, the families can send their kids in with any alcohol-based, 65% or higher alcohol-based sanitizer. So, yeah, science labs and violin and piano lessons are in person. Rest of classes. Oh, that's interesting. Okay, so Sharon's daughter showing or the classes. This is interesting. So like what classes can you do virtual and what can you do in person? So like science lab and violin and piano at the college level are in person. Everything else is online. And that makes sense. Yeah, Joanne, you're right. He does. Gabriel is super creative. Even his karate instructors, like he's so creative. And sometimes that's code for like he's doing his own thing and not listening. So, but let's see. Okay. Our school will have an isolation type room in the event a student. Yeah, so that's good. The isolation rooms are really key. And there may be a need for schools to hire more medical staff. So we might see MAs, medical assistants going into school settings where they might not be nurses, but they might be there to help. The temperatures are taking. Some schools I know have scans where people walk through the little scanner. I mean, it's just crazy. But, school definitely, it's on the mind of everybody in terms of how are we going to manage this? And it is something where we are just going to have to, with our kids, also go through it together, hand in hand, coach them through it, give them a lot of grace. And we definitely have seen, some behavioral things with Gabriel, just with the changes. He's getting sick and tired of just us. And, we need kind of a change of scenery. So we're hoping some of the things that we're going to do for him will be helpful. My 4-year-old Stella says she is glad you are talking about us, about the sickness, and she is happy you have us. Oh, that's so cute, Emily. So I will say this, Gabriel, I've got him so ingrained. We talk about it all the time. And when we were driving around, I'd say, if people aren't wearing masks, they need to wear masks. And when we go out, we're going to wear masks. And, he knows. But he'll now say, even on TV, he'll say, Mommy, that person's not wearing a mask. And so he's now equating mask wearing with good and not wearing masks with bad. And, that's kind of the focus that we've had with him is you've got to wear a mask. And people who don't, if your friends don't wear them, you need to say, please put your mask on. And so we're trying to help him communicate to protect himself. And it's crazy at that age, but, just the same thing with like them knowing what their phone numbers are and their addresses and, not talking to strangers. This now falls into that category where parents, we've got to really talk with them about how important it is to wear masks and to not scare them, but to also get that message across. So I'm happy to say he's got it. He also is on top of his herbals and his morning supplements that are immune boosters for him. And he takes his vitamin D every day. And so he's doing really good. Okay. Yeah. So college students are questioning if the financial burden of private college will be feasible if they have to go online again. And that's totally what we felt, not being in a university, but we're paying a monthly tuition for our private school. We definitely feel that, where you want to feel like you get every ounce of what you're paying for, and virtual is just it's not the same, especially for college students to be on campus and to be in classroom and to be able to buy your professor's office and, just the intricacies of that. But my concern also are the universities with on campus housing. I mean, how are they minimizing the contact? I mean, 18-year-old, 19-year-old, boys particularly, their little frontal lobes aren't done forming until they're 26. I mean, so there's still some not best decision making and then you throw in alcohol for those who are of age, it's kind of crazy. Okay, so Doc, you make a secondary channel just in case. Yeah, so I actually have a few. I have three channels. One is the wedding channel that's like on pause. But I have another one. Actually, the first one that I opened way back in like 2007. I think it was 7 or 8. I'm thinking about rebranding that and having that be my mom adventures, health, wellness related, obviously, but going through this whole time as a parent and helping other parents. So, I don't know. Let's see. Okay. So, Jenny says, feel the way about wanting to go get your money's worth with private schools with 3 kids in private schools. It is a very hard decision. And we actually, when you have a tuition in college or in school, you have a contract. And so like our contract is a really hard contract to get out of. And there's insurance, tuition insurance, and all these other things that we've had to kind of start to figure out. But definitely. So Darlene, thank you for tuning in. And I really appreciate all of you. So tomorrow is a birthday celebration. I'm so excited. So tomorrow we're going to have a little birthday celebration online. And I'm very excited if you will join me tomorrow. I'm going to have a little glass one. I love glasses. And so I'm going to have one of my favorite fun glasses for a Bellini birthday toast with all of you. It's going to be a live Q&A. Tomorrow, and you can ask me any questions. It doesn't even have to be health and wellness related. I'll be happy to answer. And yeah, so I'm super excited. So definitely give this video a big thumbs up, hit that share button, and I will see all of you tomorrow. Yay. All right. Thanks, everybody. Have a good day. See you later, YouTube. I appreciate your time. Thanks, Pat. And thanks for the card. Bye.